Good afternoon, everybody. So I'll be talking about documentation of trauma with Smart Scope Kit. So we have already seen how Smart Scope Kit is used in patient screening for the outreach programs. Here we will see that how the eye represent 0.27% of the whole surface body area, but still it's the third most organ to be affected, and it becomes a very major cause of visual morbidity, and the higher incidence is higher in the developing countries. And global annual incidence by WHO has given 55 million trauma cases and 16 million going blind. So it becomes very essential that we take a good medical history and a thorough ocular examination to conduct the management of these ocular trauma. And while the doctor is actually managing this, he forgets to do one major thing, that is documentation. So documentation becomes very important for a plan of treatment. If we want to counsel the patient for the prognosis, whether it's good or bad, and it becomes very essential for teaching as well, and most importantly medical legal cases, where this takes into consideration. And we know that paper medical records, handwritten, is very difficult, is disorganized, illegible, and EMR takes time. It takes time to document, and also the next person who sees is not able to comprehend how it is, what is written properly. And there are articles that documentation also should always be supported by photo documentation. But as you can see, most of the ophthalmologists in their clinics do not do a photo documentation because they don't have the actual equipments for that, because it's expensive, accessibility is less, the availability of these instruments are not possible every time in every place. It is very bulky, cannot transfer the instruments. Portability becomes an issue, especially in ICU patients, and also these are not very handy. So to reduce all these things, all these problems, we've introduced the Smart Scope Kit, as we already seen. So over here we use the eye handbook, a free application to check the vision testing. uh, and then we have the other few instruments like a pinhole and occluder to get the visual acuity as soon as possible. These are all the systemic investigations that we have for the trauma cases to be checked. And the major problems are in the anterior segment area, where we cannot document, and these are the instruments which we use over here. So iverter and the universal speculum helps us to take the foreign bodies. And anterior segment with intraocular lens, ASPE, is used for taking images of the anterior segment at the corneal level, the sclera, the iris, lens. And we have a range of 15 to 25 diopter lenses, where you can increase the magnification by using 25 diopter lenses. And if you need a higher field, we use 15 diopter IOL lenses. And as you can see, these are all the images that we have taken: a metal foreign body, fat prolapse, lens subluxation, iris prolapse, hypopyon, hyphema, corneal tear, rosette cataract, iridodialysis, traumatic cataracts, keratoplasty dislocation. So all these are we have been able to take without a slit lamp, and this can be done by anybody. And over here you can see how an 8 diopter IOL has been used to take this image of the angle recession. Just to mention about the IOL scope, because it's there in the Smart Scope Kit. Over here we actually use four 30 diopter lenses together, and we have been able to develop a one IOL which is one of 150 diopter also. Not that it's very important in the trauma. Then we have the Scooby Doo. Over here we have the lens along with the blue filter which has been attached, and this can be used in a lot of cases, such as this one, where you can see the Seedl's positive test. So this is actually not taken with the slit lamp. It's purely taken from the smartphone with the cobalt blue filter attached to the flashlight. And then we have the posterior segment raster pressure red cam, which we can use the any kind of a waste hand sanitizer bottle. And by attaching a 20D lens, you can actually take all the posterior segment images. And this is very easy to actually assemble and take images of. And with this, we were able to take images of choroidal rupture, traumatic macula hole, metal foreign bodies, scleral foreign bodies, especially red cam, which is very handy and we can be used anywhere. So as a result, we had more of cornea and retina cases. And I would like to tell that this is a work of 5 years that we have been able to do and bring it onto one particular kit. And this kit is very effective for documentation of trauma related findings, and especially where people are not able to take images of these. It helps in counseling trauma patients about the prognosis, and can also help in medical legal cases when we have a photo documentation in hand. It becomes very easy for us to prove our point. And this kit has actually, as I said, it's a work of 4 years, which we have been able to cut down each and every part of the slit lamp, and made it such a small, easy to do it yourself instruments, which can be done by anybody in their clinics. They can make it and they can use it for the benefit of the doctors and the patients in a very efficient way. Thank you.
So the comment from our side is only accept 4 or 5 clips. Both the papers number 2 and your paper are same, except the few pictures, that Siddle test, and 1 or 2
Yes.
such. So this is wrong thing actually. So
Actually,
you could combine together, adding those 3 slides more in one presentation, because we are seeing the whole thing, doubling the whole thing.
yeah,
I'm sorry to say that, but I do not know comments from other judges.
I
Kumar?
would like to say that there are two different aspect and application of the same instrument. The instrument was same, and we have used it for two different aspects. One is for patient screening, and the other one is for the doctors to help them document. So actually, it's two different studies, but with the same instrument. That I would agree, and I actually wanted to show how it can be done by a doctor, very simple, very easily. So this might look very simple, but it has taken 4 years, and it has made it simple because we want people to actually replicate it and use it in their practice, for both for patient counseling also and for the doctor also. So this were two different studies that we did, but with the same instrument. I agree with that, but it is for the benefit
Dr.
of both.
PRITHVI, I just wanted to congratulate you. It's a very nice paper. But the thing is, you're talking about, it has been around for 4 or 5 years. Has it been commercialized? But are people really using
Actually,
it?
we
other
have
than
used
you?
it. We have validated each one of these instruments in.
Not you. I'm talking about, has it been commercialized so that people who don't have access to portable equipment have started using this?
I have not commercialized it yet, but there are a lot of people who I know who are using these instruments right now, and they're doing it in all these periphery centers also. And but I've not commercialized it. I don't know if there are other people who have commercialized it, but I try to keep it more simpler, and so that everybody can replicate it. That's the main point.
Thank you.
Thank you.